Dublin Aids Alliance is a voluntary organisation, and its role is to provide support for people in Ireland who are living with HIV, their families, their friends, their partners, and also in the wider society to increase awareness of HIV and awareness of general sexual health issues. And also, as part of this work, one of our key roles is trying to combat and eradicate, if we can, the stigma that still attaches to HIV. And I suppose we do it through two main services. We have our community support service, which is very much about the support needs of people who are living with HIV, their families and their friends. They've changed a huge amount in the 25 years we've been in existence, because when we started 25 years ago, we started in a real crisis situation. At that stage, people were very, very sick and dying of AIDS, so we really were a crisis service. That has changed a huge amount because of the development of the medication around HIV. It's now a manageable chronic illness, but we still do deal with people who have significant health problems because they've a number of years HIV positive. Again, one of the main roles of our community support service is around trying to support people in having sort of a stable lifestyle. That's a crucial part of the effectiveness of the medication, is that people are in a stable lifestyle. And again, because in the 80s, 90s, the majority, in fact, of people who tested HIV positive, particularly in this part of the city, were drug users. For lots of reasons, their lifestyle over the years wouldn't have been that stable, and as a result of that, then they still would have quite significant health needs. But also too, we need to work with people around their housing issues, income issues, often family issues, legal issues, all of those kind of things. That kind of work is done by the community support service. Then our prevention education training service does, as the name suggests, its role is to carry out all of the education prevention work around HIV, around sexual health. We do that in a whole range of different ways. We do run our own training courses here in the building, which are accredited. We provide training to a whole range of organisations, statutory, voluntary, community, around HIV and around sexual health, particularly recently a big demand from youth organisations, which is great to see. And then we do a lot of work out in various venues, colleges, so on, take part in events, and also develop and launch our own campaigns which are aimed at increasing people's awareness around sexual health issues.
So we launched the Just Carry One campaign on Irish AIDS Day on the 15th of June this year. And it's primarily aimed at young people to prevent STI infections. It's a social media campaign, and it was developed in consultation with young people who helped us come up with the different methods of engaging with young people with key messages. So it's primarily through Facebook, Just Carry One, and through Twitter, Just Carry One. The main aims are to promote consistent condom use among young people, to ensure that young people use condoms all of the time to prevent STI infections, but also to address issues of stigma related to condom use and promoting a positive attitude that it's fine to carry a condom and to use condoms. And it's all part of promoting sexual health and healthy sexual relationships among young people. So some of the key messages within Facebook itself, it's done through video, and it's done through games, and then it's also done through competitions to engage young people. So you can watch a video on STI statistics. You can play a game called Rubber Bounce, which has several different key messages, and it's quite fun for young people, promoting that, for example, using drugs and alcohol can affect your decision making around sex. And also promoting that free condoms are available for young people, because we're trying to also break down those barriers where people have issues getting condoms through maybe that they're embarrassed, or maybe simply that they cannot afford them. So as part of the campaign, Dublin Aids Alliance is providing access to 40,000 free condoms, where young people or any person can just walk into Dublin Aids Alliance and ask for the free condoms. Or youth organisations or other organisations can ring us up, and we can provide you with condoms for your particular client group.
Yeah, and as I was saying, we are marking our 25th year here in DAA, and there have been very significant changes since we were set up in 1987. Again, in our early days here, a very significant number, in fact majority of the people using our service were drug users, and that would have been the case, I suppose, in the 80s and into the early 90s. Overall, we've seen it in the figures since 2004. Every year since 2004, in the HIV stats, we have seen the numbers of new cases of HIV amongst injecting drug users has been going down. And this has been a direct result of the services that were put in place for drug users, the harm reduction services like methadone, and the obviously very particularly needle exchange services. So this is obviously a very welcome development, that the drug using population has gone from being the main group that were contracting HIV to the numbers decreasing each year. However, it should be said that there are still new cases every year, and that's something that's sometimes lost. While it's really important to be clear about the successes of the harm reduction approach and what works, it's also important to note that there are still drug users who are becoming HIV positive. And I suppose a little note of caution this year was that there's a significant number of late diagnosis among the HIV figures for drug users. And again, we need to have a look at what's going on there. It may be possibly people from Eastern European countries who are less likely to be in touch with the services. So again, it's something we need to keep an eye on. It's always part of the experience, I suppose, with HIV, that there's kind of no room for becoming complacent. Again, I suppose the experience of the LGBT community would very much illustrate that. Again, back in the early days of HIV, the gay community was one of the communities most affected by HIV. And again, as part of that, they were very much to the forefront of the response. The gay organisations led the response in many ways and were very, very active in the early days of Dublin Aids Alliance. And then I suppose over the years, a sort of complacency did set in, and it did go along too, I think, with the sense that the illness was no longer as serious as it had been once. And I know certainly, I suppose a good illustration of it would be that when the LGBT youth organisation belonged to was established 9 years ago. At the time, they didn't see that HIV would be an issue particularly for them as an LGBT organisation, because they were dealing with the younger generation. But over the last couple of years, it has come onto their agenda very, very clearly as an issue, because young gay men are testing positive, and at this stage the biggest number of new HIV infections each year is in the population of men who have sex with men. So again, it's on the one hand, it's now good to, it's good that we have that information, because it enables us to target the prevention work. And again, World AIDS Day last year, we saw for the first time ever the HSE and GHN launched a national campaign just specifically targeted at men who have sex with men, in order to make them more aware, to encourage them to test, to encourage them to use condoms. And that kind of targeted campaign is really important. And again, I suppose the overall message, what we're talking about drug users, the gay community or whatever, is that there isn't room for complacency as long as there are new cases. Again, it's something we say in DAA at this stage. Something like HIV should actually be preventable. We know enough about it for it to actually be preventable. There don't have to be any new cases, but every year we do see new cases. This year we have about 320 new cases. So there are new people every year who contract the illness. And again, it's all this balancing. While we're aware that, yes, medically the situation has improved hugely, and it's really important to say HIV is no longer a death sentence, but it's still a serious illness, and it still involves being on medication for the rest of your life. So it's still really, really important that we get the message out there that you can protect yourself from HIV in the same way as you can protect yourself from other sexually transmitted infections. It is something you know that you can avoid if you do the right things. So yeah, we need to work harder on getting that message out there.
So we've seen in over a 10-year period, in terms of the STI infections in Ireland, we've seen them increase 46%, from just over 8,000 STIs in 2001 up to just over 12,000 in 2010. So this campaign again is trying to decrease STI infections. Also, what we're seeing, the HSE Crisis Pregnancy Programme issued research recently, and we're seeing quite encouraging findings around young people using contraception, but we're not seeing, we're seeing a low percentage, I suppose, of people using contraception all of the time. And again, this is about consistent condom use. With 21% of people said they didn't use contraception all the time. And the research asked them why. You have 19% of people who were saying basically sex was unplanned for, and you had another percentage of people saying that they simply couldn't afford the condoms, and 37% said they were embarrassed to access contraception. In terms of breaking down the barriers associated with condom use, well, the cost is a big one. We saw in 2008, for example, the government decreased the VAT rate from 21% to 13.5%, but we're still seeing in terms of European countries, Ireland is one of the highest in terms of the price of condoms. Again, we're trying to promote either low cost or free condoms with the campaign based on that research.